You want to know how to have the healthiest sperm to get pregnant? Stick around. Welcome to the Hypno-Baby channel. I'm Dr. Natalie Fiset. I'm a retired family doctor who delivered 3,700 babies. This is your channel, so don't forget to comment, like, share, subscribe, and be amazed. Of course, there's a big medical disclaimer. This channel is for entertainment only. You use it at your own risk. I am a doctor, but I'm not your doctor. Hi, I'm Dr. Natalie Fiset. Today we're going to talk about how you can have the healthiest, strongest sperm to get pregnant. You have to know that about 30% of infertility is due exclusively to male factor. And there's another 20% that's his and hers, if I can say. So it's a mixed component. So here are the main factors, the one that you can control that will help you have a healthy sperm and help you conceive a baby easily. So the first one is if you smoke, you have to stop right now because actually you have to stop 3 months before conceiving the baby. That's the optimal, but any time is good actually. If you stop, it's great, because if you smoke, your sperm are gonna be lazy, slower, and might be deformed, and it won't be optimal for sure. The second thing is alcohol. You have to, it's not completely cut off alcohol, but we know for a fact that if you abuse alcohol, then again, you might have sperm problems. If you're very obese, that will cause many things, like it could cause diabetes, high blood pressure, and that all affects your sperm. And also, if you imagine a person that's very obese, it also, like, how should I say, the skin like folds, and then it keeps the testicles too warm. So that could also impair the function of the sperm. Your past and your present history can affect your sperm. So let's say you've had an infection, a sexually transmitted infection, that could affect your sperm. And also, if you've been around the block, let's say this, you need to get checked. Some infections or don't give any symptoms, and that could affect your sperm and your fertility as well. So that could be a good thing if you're planning on conceiving a baby. Also, if you've had a trauma in the groin area, but not the Simpsons like football in the groin, really something that brought you to the hospital, a major trauma, that could affect your sperm count. That's in the past, but in the future too, you have to protect your little swimmers. Now for the bad news, junk food will affect your sperm. So you have, not, don't cut off everything, but really slow down on junk food. And a healthy diet with a lot of greens, not too much fruits, but some fruits, and omega-3 is, they're known factors to improve your sperm count and motility. To test the sperm, it's fun because if you have infertility, the women have all kind of tests and biopsies and ultrasounds and what have you. And for a man, it's just a sperm count in a cup and we have all our information. So what they check is 3 factors. They check the number of sperm, they check the motility, how well they swim, and their appearance, their morphology, I'll say it. So, and these 3 factors together will give you like a sperm analysis. A funny anecdote, because I love to give you funny anecdotes since I've delivered 3,700 babies and I've had so many patients in my 25-year medical career as a family doctor. So one of my patients was really not patient. She didn't deserve the name patient. She had a new spouse and she wanted a baby like right now, and it doesn't happen this way. Within 1 year, 85% of the couples will conceive, but she only tried like for 1 month, and then she's like, oh, I want him to do a sperm count. So we did a sperm count, and when I received the results, I look at that, and even the pathologist, the doctor who examined the sperm, like in the comments, was like almost writing, "I've never seen this," and he had the worst sperm analysis you can imagine. He had like couple of sperm only, like really under the normal count. And then they had two heads and they were missing tails. They were swimming in in circle. I'm laughing because it has a happy ending, of course. And like nothing was right. You only had like a couple viable sperm. So I said, "Oh boy, when I tell her this, she's gonna flip. Like she's gonna blame him. She's gonna like he's gonna get the frying pan on his head." So sure enough, I bring her the news that the sperm count and the motility, like they were, like I said, swimming in circle and not moving much, and they had two heads and sometimes no tails or whatever. So I told her, like, this is the results, and then I said it only takes one. And sure enough, the next month she was pregnant with him. So they had a beautiful baby, and the story ends well. That's why I'm laughing. But it tells you that even if you have a sperm count that's not perfect, it doesn't mean you cannot conceive a baby. Far from there. But with all the factors we're discussing right now, you can improve your chances of getting pregnant a lot. Also, drugs, if we're talking about street drugs like marijuana or cocaine or whatever, and prescribed drugs like medication have effects on the sperm for many of them. So discuss it with your healthcare provider and cut down as much as you can, health in a healthy way, of course. And like I said, discuss it with your doctor definitely. The other thing is chemicals. If you're working in a really toxic environment, discuss it with your doctor if you need to protect yourself and protect your sperm as well. You have to know that if you're on any kind of steroids, the joke of having little nuts and all that stuff is true. So yes, it does affect the sperm and the testicles in big ways. So you have to choose. You have to make a choice here. Either you want to be a father, or you want to keep on taking steroids, but it's not good and it could affect your baby's health even if you conceive. So that's really like you have to make a choice here, definitely. Of course, fertility goes down with age, but we've all heard like Charlie Chaplin being a father way beyond the age 60, so it's not as early as with women fertility, but still there's a higher chance because the sperm is older, so it could have more malformations and more problems for the baby. So the recommendation is, if you know you want a family, start it now. The elephant in the room is erectile dysfunction, that even if you have perfect sperm count, if they cannot get out and do their jobs, it could be a problem. There's a lot of resources, either the blue pill, the Viagra, or definitely seeing a therapist, consulting in fertility, and making sure you're well taken care of. That's it. You're ready to conceive. By the way, notice my face. I forgot to put my ring light on before. I'm not re-recording everything, so tough it out. But this is what I look like in daylight and in ring light. So you're ready to conceive. You're eating well, less junk food, more greens, more omega-3, no drugs, and no cigarettes, not excess alcohol. You're protecting yourself physically, not to have any trauma. And by the way, they say if you want to conceive, in order for the sperm not to be too diluted, to be more concentrated, you should have intercourse every second or third day, especially around the ovulation period. Your partner will tell you when the ovulation is. Don't worry about that. So once you're pregnant, I highly recommend that you sign up for the Hypno-Baby program, where you're going to have all the information to live your pregnancy and especially the birth in a very positive manner, instead of saying, let's get through this. We've had so many women giving birth beautifully and bonding with their babies, and that's where the family starts. And it's a very empowering way to live the experience of meeting your baby for the first time. And most women was said that they had a very comfortable birth and they did not need any medication, any epidural or nothing. So it's really powerful what I teach you in there. So the link's going to be below hypno-baby.com. See you in the next video.